Paul, Governor Abbott is taking steps to help hospitals overwhelmed with COVID patients.
The governor is now deploying 2,500 medical personnel to help with the demand. This all comes as Texas is reporting concerning numbers yet again today. Here's the breakdown. There are more than 11,000 new cases and more than 10,000 COVID-19 patients in Texas hospitals. The state also reports it only has 321 ICU beds left, exceeding the previous low record of 329. Let's get out to Marcelino Benito now live at LBJ Hospital with more on the need for medical staff. Marcelino.
Well, Mia, too many COVID patients, not enough nurses. That is the problem they're facing here at LBJ Hospital and other hospitals across our region and state. So today we work to find out when that much needed backup is going to arrive.
They are scared. They are exhausted.
Nurses on the front lines of COVID, overwhelmed by the cases that don't stop coming in. Chief Nurse Maureen Padilla says at LBJ Hospital, they're running out of space and desperately need more staff.
Very disheartening to nursing personnel who have been working so hard, and we're finally beginning to be able to breathe again, and we could give them some time off again. And just very quickly, that turned right back around.
It's why Governor Abbott has requested 2,500 out-of-state agency nurses to help overloaded hospitals. Last summer, 14,000 out-of-state nurses were deployed across Texas.
2,500 across the entire state is going to meet some of our needs, but it's not going to be enough.
The Department of State Health Services already processing requests from hospitals across the Texas Medical Center and the state. Harris Health System is asking for 80 ICU nurses alone.
And then, we'll be able to start sending out staff to various regions around the state. And it really is going to be every region across the state.
DSHS tells KHOU 11 News approximately 750 nurses will be sent to hospitals in the Houston, Galveston, and Beaumont region in a few days. They're coming from across the country to help.
Any bit of assistance will be helpful to us at this point.
Dr. David Callender, president and CEO of Memorial Hermann Health System, says there's more that we can all do to stop this surge, and that message has been communicated to Governor Abbott.
But as a group of healthcare professionals, I think we said pretty clearly that we would like for people to be wearing masks, and to the extent that we could require it or strongly encourage it, that would be very helpful right now.
Now, DSHS tells me tonight that they do have enough state funds to pay for all of these nurses through the end of September. But if this surge were to last any longer than that, we could be facing a whole nother type of problem. Mia, back to you.
Very hopeful cases will peak soon and more workers won't be needed in the long term. Marcelino Benito tonight. Thank you.